Hello and welcome to ANAT-AV. In this video, we'll be taking you through the anatomy of the radius, focusing on site determination, special features, surfaces, attachment, and finally, its applied anatomy. Of the two bones in the forearm, the radius is the lateral bone. It has an upper end, lower end, and a shaft.
We'll start off with side determination. To orient the radius properly, one needs to distinguish between the proximal and distal ends, as well as the lateral and medial sides. The proximal end contains a disc-shaped head, while the distal end projects laterally as the styloid process. On the medial aspect of the proximal radius is the radial tuberosity. At the distal end, the anterior border is in the form of a thick, prominent ridge, while the posterior surface presents the palpable dorsal tubercle of Lister. And thus we can conclude that this is the right radius.
The radius has a number of unique features in its shaft as well as its proximal and distal ends. The upper or proximal end has a disc-shaped head, and close to the neck, the medial aspect presents the radial tuberosity, as was mentioned previously. The proximal concave surface articulates with the capitulum of the humerus, contributing to the elbow joint. The periphery of the head fits into a socket formed by the radial notch of the ulna. The radial shaft is triangular in cross-section and has a sharp interosseous border. The interosseous membrane is attached to the distal 3/4 and attaches the radius to the ulna. The lateral surface is gently convex.
The distal end or the lower end is the widest part of the bone. The distal end also contains an ulnar notch for articulation with the ulnar head. The anterior surface of the lower end forms a thick, prominent ridge. The posterior surface presents the dorsal tubercle of Lister, which lies lateral to an oblique groove. The lateral surface is prolonged downwards to form the styloid process. The inferior surface has a triangular area for the scaphoid bone and a medial quadrangular area for the lunate bone. This surface takes part in forming the wrist joint.
Now, we'll talk about the muscle attachments of the radius. Biceps brachii is attached to the posterior lip of the radial tuberosity. Supinator is attached to a V-shaped area on the lateral surface of the shaft. Pronator teres attaches to the middle of the lateral surface. Brachioradialis attaches to the lowest part of the lateral surface, proximal to the styloid process. Attachment of the pronator quadratus is to the distal part of the anterior surface of the shaft. Radial head of flexor digitorum superficialis attaches to the proximal anterior surface of the radius. Flexor pollicis longus is attached to the proximal 2/3 of the anterior surface. Abductor pollicis longus and extensor pollicis brevis are attached to the posterior surface.
Let's take a look at the applied anatomy of the radius. Colles fracture. It is a fracture of the distal radius, commonly caused by a fall on an outstretched hand, and the distal fragment is dislocated upwards and backwards. The reverse occurs for Smith's fracture, where the distal fragment is displaced anteriorly. Radial head fracture can be caused from a fall on an outstretched hand, due to it being crushed against the capitulum of the humerus. Subluxation of the head of the radius is when the head is dislodged from the grip of the annular ligament, and it is very common in children.
That's a wrap of the anatomy of the radius. Be sure to like and subscribe if you found this video useful, leave a comment down below, and share with your friends. See you in the next episode. Thank you for watching ANAT-AV.